Hi and Assalamualaikum. Today me, Wanu Safira, and my group mates Wani and Nida going to present Pharmacology 3 case study assignment. Our group got the topic lung cancer. Before we start, here is our presentation content. It concludes definition, pathophysiology, causes, sign and symptom, and lastly management. Without further ado, let us start our presentation now.
So for the definition of the lung cancer, cancer that form in tissue of the lung, usually in the cell that line the air passage. It happens when cells in the lung mutate, grow uncontrollably, and cluster together to form a tumor. So for the physiology of lung cancer, it happens when repeated exposure to carcinogen, particularly of cigarette smoke, lead to dysplasia of lung epithelium, and then it causes genetic mutation and affect protein synthesis, bind with cells DNA and damage the cell. The cellular change and abnormal cell growth occur. And the fourth one is malignant transformation of pulmonary epithelial cell. And the last one is this cell will grow slowly and cover segmental bronchi and lobes of the lung.
Here is a real case study of someone with lung cancer. So for the summary of the case study, on August 2021, the American comedian Kathy Griffin was diagnosed with stage 1 lung cancer. The doctors revealed that she has a mass expanding on her left lung, which is the cancer, and that is in need of surgery of removing one lobe of the lung. After the procedure, she had noticed a change in her voice. Her voice sounds more hoarse and is not in the usual high pitch anymore, which is one of the side effects of the surgery. So now she is still in recovery. However, she later on shares that she has never felt better recently.
So, what are the causes of lung cancer? Lung cancer has several causes, but smoking is known as the largest cause, although it can also strike people who have never smoked. Besides, exposure to radiant gas such as uranium, thorium, and radium can also lead to lung cancer. These chemical elements can be present in soil, water, and construction materials. When you inhale, these radioactive particles can damage the cells that line the lung. Next causes is exposure to secondhand smoke. Have you ever wondered what is secondhand smoke? So, basically, secondhand smoke is when non-smokers are frequently exposed to smoke when someone nearby is smoking, which exposes the non-smoker to health hazard. In public locations like restaurants, workplace, shopping malls, public transportation, auto parks, school, and daycare facilities, among others, non-smokers may be exposed to secondhand smoke. Even though it is inhaled in a more diluted form, secondhand smoke is just as harmful as regular smoke. Studies conducted in the United States have shown that secondhand smoke exposure increased the risk of lung cancer in non-smokers by 20 to 30% and result in more than 7,300 non-smoker lung cancer deaths annually. Not to forget, cancer-causing agents like asbestos, arsenic gas, and diesel exhaust can also cause lung cancer. Although cells with cancer-causing mutation is normally inactive, it can accumulate naturally as we age. Scientists reveal that air pollution wakes these cells up in the lung, encouraging them to grow and potentially form tumors. Last but not least, lung cancer can happen due to genetic changes. It is because mutation in the EGFR or KRAS gene lead to the production of a protein that is constantly activated. As a result, cells constantly receive signals to proliferate, leading to tumor formation. When these genetic changes occurs in cell in the lung cancer will develop. Now, let's move to signs and symptoms. The signs and symptoms of lung cancer may vary depending on the form of lung cancer a person has and the stage of their disease. According to Mayo Clinic, lung cancer does not usually cause symptoms at its earliest stage, and symptoms usually show up when the cancer is advanced. Those include persistent cough, coughing up blood, shortness of breath, chest pain, hoarseness of the voice, extreme weight loss, bone pain, and also headache. If a person experiences most of these symptoms, they are advised to seek medical attention immediately, as it may be an early sign of lung cancer.
The type of treatment best depends on the type of lung cancer that the person has, its size and position in the lung, how far it has advanced, and the person's overall health. Lung cancer treatment options include surgery to remove all or part of the affected lung, radiation therapy, chemotherapy, and immunotherapy. Surgeons will usually recommend lobectomy, which means removal of one lobe of the affected lung for early-stage lung cancer. After surgery, the patient should be able to return home 5 to 10 days later. They may feel body ache and stiff or stuffiness in the breathing, so the patient is advised to practice breathing techniques and do light exercises or stretches at home whenever they can. This is in order to increase strength and fitness.
So this is our reference. So that's all from us. Thank you.